Okay, then we looked at our diarthrotic joint. Fluid between them, synovial fluid, which I told you most books describe as about the consistency of egg whites. Right? It's to lubricate this cartilage and also provide nutrients. The lining on the inside of the capsule, which is very strong, which is called the synovial membrane, which you go over in A&P, basically has modified capillaries in it, and that's where the synovial fluid comes from. Okay, we talk about a disease that causes inflammation there. What was that called? You go over in pathology. A disease that affects the synovial membrane. Rheumatoid arthritis. Okay, rheumatoid arthritis basically is where the immune system is attacking that membrane. Okay, it causes a lot of pain, inflammation, swelling, hands and feet, mainly middle-aged females. Then this is the articular cartilage, which is what type of cartilage? Hyaline. That's where osteoarthritis starts, which is the most common condition that you and I treat. Wear and tear diseases. Those are ones that we're all going to get. Here's the nice smooth hyaline cartilage. I told you to come up and feel it. Right? It's nice and smooth. You feel that? Nice smooth. Right there's the glenoid cavity. Right? You know all these muscles now. They're all rotator cuffs. You know them all. You know them. You know. And here's the hip joint. We'll go over that later. A little bit different than the shoulder. I told you the biggest difference is this one's deep. Shoulder's shallow. Okay, it gives us more movement. Gives us weight distribution. And I told you if you don't take care of it, you're looking at one of these in the future. Okay, and that's a replacement. Okay, a replacement. Knees are replaced a lot as well. Okay, we still haven't produced any material that's better than what you got. Right, so we want to try to take care of it. Then we went over the 6 different types of synovial joints. Okay, we'll go through this and then we'll take a short break. Gliding, also known as plane joints. Just a little bit of movement, right? They don't move in any particular plane. Okay, just kind of back and forth. They just glide. Okay, and I told you that those are the most abundant by far. Okay, we went over the AC joint was a gliding joint. We'll go over to the carpals, our gliding joint. They just move around a little bit. Not any particular plane. Then we talked about the hinge joint. Give me an example that we went over that. Elbow. Okay, elbow's a hinge joint. Just kind of moves back and forth like these hinges on the doors. Okay, so if a muscle goes across the front of it, it's going to flex it. If it goes across the back of it, it's going to extend it. Just like a hinge. Okay, no abduction there, no adduction, just a hinge joint. We'll go over a bunch later. Pivot joint. Okay, give me an example of that. Radius and ulna. Where else did we have? C1 and C2. What did that enable us to do? Right, rotate your head back and forth. 80% of the rotation of your head occurs at C1 and C2 because of a pivot joint. Okay, a pivot joint. This is where supination and pronation occur at that radius and ulna. Right, then we're talking about ellipsoid or condyloid joint. Ellipsoid or condyloid. How many planes? 2, right? 2 planes, right? And so we're going to have movements in 2 planes, such as this joint, which is your knuckles, your MCP joint, right? They flex, extend, abduct, adduct. So if a tendon crosses that, we want to come up with 2 actions. We'll go over other condyloid or ellipsoid joints later. Okay, later in the body. Saddle enables us to do opposition. We find that between this carpal bone and your first metacarpal. They're both shaped like saddles, right? And they fit on each other like this. It's a modified ellipsoid joint. Gives us a lot of movement in there. Opposition. We also, that SC joint was a shallow saddle. Say that 10 times. Ball and socket, right? You only find in the shoulder and hip. Okay, shoulder and hip, that's it. Right, a lot of movement. You can see it's multi-axial. That's why we got to learn all those actions, even internal and external rotation. We got to learn those too. Okay, as well. For the ball and socket, but only in the shoulder and hip, and that's it. Yeah, Leslie.
I wrote down a word and now I forgot. I didn't write down the meaning. Anarthrosis.
Anarthrosis is the AKA for ball and socket. Yeah, thanks.
For the hinge joint, you said the muscle is in front, then what? The muscle?
It depends what hinge joint we're looking at. Okay, where it is, but in the elbow, right, if a tendon crosses the front of it, okay, remember muscles get smaller, they pull like a piece of rope, tie, pull, they're going to flex. Okay, if it goes across the back of it, it's going to extend. Okay, but we only got to come up with one action, a hinge joint. Doors only open and close. That's it. They only open and close. What was the AKA for the hinge joint? Giggly miss. Okay, you love that word. I know you do.
My name is Dr. Phillip Dodge, and I teach Myology day program. The class is very integral to like a massage therapist's success. You know, obviously it's basically a science class that is focused on, you know, muscle origin, insertion, which are the attachment points, nerve and actions of muscles. That's basically the focus, but also learning all the joints and ligaments and bones in the body as well. Initially maybe like the terminology, but also like visualizing the action of the muscles, which is really important if you want to insert that information into long-term memory. A lot of visual aids, you know, that really helps people that are hands-on learners, different pictures of the muscles, three-dimensional models, videos, but also using each other's bodies, you know, and hands-on muscle techniques. Just realize that the class is, you know, high level. It is on par with a lot of other science classes that I teach at universities around the area. So it is a very tough class, and it's a lot of information, fast, quick, and you got to stay on top of it. You really can't wait to study the material before the test. It's not that type of class.
What we're going to talk about is going to be the skin. It consists of two layers. The epidermis. What's the prefix epi? On top of or around, like the epicenter of the earthquake. Okay. And then we're going to have the dermis, which is the underlayer. The dermis is the true skin. Okay, the true skin. We say that because the epidermis, the outermost layer, is not alive. It's the top part's not alive. In the dermis, the underlying second layer, has a framework of connective tissue. Has blood vessels, nerve endings, and glands. This is where all the things that are alive. There's blood flow here. As you get towards the top, the lack of blood flow causes the cells to die. Right, so the cells on top that you can touch, right, you can scratch, not alive. Right? Anybody ever have their hair cut? Or seen somebody that had their hair cut? Right, does it hurt?
No.
Right? The cells are not alive. Here's an illustration, right from your book. A lot of information in this picture. Right now it's going to look confusing, maybe a little disorganized. By the end of this chapter, you'll know this guy inside and out. Epidermis, right? Let's take a look at what we got. We'll talk about the layers. The top one is a stratum corneum. The bottom is a stratum basal. Stratum just means layer. Okay. Take a look at our true skin, our dermis. Also known as corium. All these structures, blood vessels, the hair follicle. Here's a bit of smooth muscle. You know what this is? The erector pili. Okay. What's it responsible for? Goose bumps or goose flesh. Okay. Causes your hair to stand up. What's the function of that? Used to be when we were a bit fuzzier. Okay. So for warmth, the hair stands up, it creates some airspace. The body can warm the air, it creates an insulation, just like the pink stuff in your walls were. Airspace. See how close to the epidermis this one is? Okay, this is touch, light touch, or they call it light pressure. Anyone who's ever had their hand fall asleep, and you feel it? Now, you can't feel it, but you know you're touching it, right? How do you know? Right? You got a deep one down here, pressure receptor. So you can push on it, you feel it, the push, but you can't feel the touch. All right, a little deeper, a little more stimuli. We'll talk about each of these. If you talk about nervous tissue, okay, these guys are going to be the dendrites. They'll be carrying information to a cell body, to a neuron, right, heading towards the brain and spinal cord. We also have free nerve endings. Free nerve endings. We came across a little bit in nervous tissue. This is for pain and temperature. Right. With receptors, you have neurotransmitter. They can be exhausted, right, like touch. If you're really not aware of your clothes touching you, right, you get used to it. All right, pain and temperature receptors you can't get used to. It's a safety mechanism. You touch something hot, you pull away, right, every single time because it causes damage. Something sharp, right, it hurts, you pull away. It's a safety mechanism to keep you from doing damage to your organ systems. You've got a couple of different glands. We talked about glandular tissue last time. We got sudoriferous glands, which is the long word for sweat glands. And we have sebaceous glands, oil glands, or sebum. Okay. These are in the skin. And then just below here, the subcutaneous layer, which is technically not part of the skin. The skin is 2 layers, epidermis and dermis. The one below it is subcutaneous. What's the alternate name?
Adipose.
Adipose. What was it? Stratobasal? No, below, for the subcutaneous. Hypodermis or superficial fascia. You've got to know all 3 of those. Hypodermis, subcutaneous, superficial fascia. Not technically part of the skin. It is part of the integumentary system. Good board question. On top of the skin here, we have pores. This gland has a duct. It has a duct which delivers its contents to the outside. What kind of gland?
Exocrine.
Exocrine. Okay, good. Exocrine. Versus, which makes hormones. Good. Top layer. From the top. This is what you can touch and see and inspect. The epidermis. Epidermis, around the dermis. Top of. This is a surface portion, constantly lost through wear and tear. 80% of the dust in your house, dead skin cell.
Hi, I'm Dr. Tristum Eaton. I teach the instructor for anatomy and physiology. I also the instructor for the evening myology and the pathology courses. I'm lucky enough to be able to teach a little bit of each of the sciences. So I do teach the myo, the anatomy, and the pathology, which is the fundamental basis for your education. Anatomy and physiology is going to be the study of the structure and function. The myology course is really a specialized area of the anatomy and physiology, probably the largest portion of your sciences. And then the pathology, of course, is going to be the study of what can go wrong with the normal anatomy and physiology. Well, with anatomy and physiology, understanding the normal body functions is imperative for being a healthcare provider, a massage therapist, and knowing what to look for in case there's something wrong, knowing when to proceed, when not to proceed. I always present this as a 2-part course. Okay? The first part is conceptual, where you're going to be learning how things work in a different way. The other part is it's a language course. I think one of the most challenging things is the vocabulary. You're going to be taking a course where it's a whole, based on your experience, could be brand new words. Understanding what the words mean, then you can apply to the material. This gets into students' individual learning styles. If you're an auditory learner, some people audio tape the classes, or record the classes and listen back. Some people are visual. They like to draw pictures, label pictures. Right? Some are kinesthetic learners, touching the models, looking at the skull, skeletons. I try to present the material with a little bit of each, and then we do different exercises in the classroom in order to kind of hit on each individual learning style. The biggest trap some students fall into is that they've already made their mind up about how things are or should be, or what they've learned before. And just keep an open mind. We have some really great instructors here. The administration, everybody's here to try to get this information to you.